Well, as the ongoing homeless crisis continues to plague San Diego, there's been millions of dollars thrown at it to try and fix it. But what do experts think is the logical next step? Joining us now is crisis coach Scott Silverman, and you're saying that drug addiction is also a first big step in really helping this problem.
Well, if you take a look at all the data, all the studies that have been done in my involvement since the 80s, almost north of 70% of the average individual who is unhoused, if you will, is under the influence of something mood altering and or has a mental health issue.
Yeah, they seem to really be going hand in hand, but it's clear that whatever we're doing as a city, as a state, it's not working. So what do we do now?
That's a great question. and think about this. California has half the homeless in the country. So when you think about that, we should be a lot better off than we are today. And when you look at the point in time counts, the numbers continually have grown. So if the question is, if I had a magic wand, which I know we talked about earlier, you know, I like to say that if you do what you've always done, you're going to get what you've always gotten, which is another way of saying insanity is if you keep repeating the same thing. We have a lot, I think it's 26 billion the governor just depicted over the last 5 years. So I don't think it's a money issue. I think it's a management issue. I think it's accountability. The mayor in Los Angeles and in Sacramento, and I'm sure soon San Francisco, and there's conversations here in San Diego. We need to do an audit. We have to take an inventory of the resources that we have, find out who's doing what, and ask themselves if they have an outcome. And what's that outcome look like? And how are they measuring it? I'm a social entrepreneur. I run a nonprofit for veterans. I run a for-profit treatment center. If we don't do well, we can't pay our people and we won't stay in business. But the social service industry, which I was a big part of for a long time, finds a way to keep moving on one way or another. And we have to put an end to that if we're really going to create systemic change.
So someone in your position, you are boots on the ground, you're seeing the change day to day. What percent of people are really impacted by not only the mental health issue, but also the addiction issues that we're seeing?
I would say the number I'm going to stick to, it's north of 70%. And what's fascinating when you think about studies is the impaired person will negatively impact 8 people every day. And if you ask people, have you ever been negatively impacted by a homeless person, whether it's on a street corner or coming up the Panhandle or watching somebody who's suffering on the street, and just recently there's been discussions around putting 1,000 people in one warehouse. And I say to the people that are in charge of that, without making any political statements, would you put your mom there? Would you put your sister there, your brother, your cousin, your uncle? How can you think about warehousing people who are already behind the 8 ball and impaired and have a whole host of needs that we as a community have to start respecting and understanding? Homelessness is not a disease. I mean, I work with people that have a disease of addiction. Homelessness is not a disease, and I've met tens of thousands of homeless people that have said, raise their hand and go, I am so excited about being homeless. Sleeping in urine and going through dumpsters is awesome. Never heard it once in decades.
Scott, like we said, if it was an issue that could be solved, I hope we would have already solved it right by now, but we're still seeing millions and millions of dollars just kind of thrown at this. So,
billions.
Billions, really. Yeah. Well, Scott, thank you so much for your work. Continue your great work and efforts of just kind of trying to crack the code and get a solution for everyone here, especially in San Diego.
I think there's some great resources out there. I just think we need to find a way to manage them more effectively. And thanks for the opportunity. I mean, KUSI has been talking to me, since I came out of high school about how we can help. So we need to shorten that timeline. We're losing too many people.
Definitely. Scott Silverman with us tonight. Thank you so much for being here. I greatly appreciate it.